I'll wait and see if it only does. Oh no, it looks like it's still recording, so. Okay. My name is Tiffany Hamlin, and this is my head-to-toe assessment. This is Michelle. She's my patient. A typical patient, I would ask, first I would get their height and weight, and then ask them to get into a gown so that I can listen and be able to hear lung sounds and such better. And then I would get their vital signs, blood pressure, heart rate, respirations, temperature, and then we would start the exam. They're recording?
Yeah.
Okay. So as a patient's walking into the room, other things that you would look for is you would observe their gait, also just observe their body stature, how they're moving, how they speak, things like that, just to take note as you begin your assessment. And so I'm going to start with her head and face, and just looking at just looking at her face, looking at her skin, just observing, inspecting, see if there's anything that I need to take note of. Characteristics of her eyes, the shape of her skull, anything like that may have staples. And just as I'm looking, then I can also just touch her hair, scalp, see if there's any indentions, anything like that that would need to take note of. Then I can ask her just to see how her facial muscles move and work to follow a couple of commands. So can you smile? Stick your tongue out. Clench your teeth. Okay. Raise your eyebrows. Okay. Puff your cheeks out. Squeeze your eyes closed as tight as you can. Okay. And I think that was all of them. And again, as I'm touching her face, I can touch on her sinuses and ask if there's any pressure. Is this sensitive? Feeling around her jaw. Have you open your mouth and close? Seeing if there's any issues with her jaw. And I think that's it for this part. So I'm gonna pause it for a second.
Okay. We'll have to see about the audio.
One last thing to check on the for the head and face assessment is the sensation that that she has on her face, and it needs to be symmetrical on both sides. So something sharp. I just didn't know. Okay. So I'm gonna have you close your eyes, and you're gonna tell me whether you feel something that is sharp or dull. So. Don't move. Okay. That's my hand on your face.
Dull. Oh, sharp.
Okay.
Dull.
Actually, over here.
Sharp.
Okay.
Sharp. Dull. Sharp.
Okay. And then same thing. Keep your eyes closed and just tell me. You feel that?
Mm-hmm. Yes. 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 Yes.
And is there any difference between the sides, the way that you feel it?
No.
No? Okay. Alright. Now, as far as assessing the cranial nerves, I already was able to assess cranial nerve 5 and 7 when I had her do the different facial movements. That was what helped me assess those. Knowing that she could do those movements makes me know that those nerves are working and functioning. Cranial nerve 1 is goes along with your ability to smell. So what I would have her do is again to close her eyes, and I would have something that is a distinctive smell like an orange. I would hold one nose closed, one nair closed, and have her smell and be able to tell me what the smell is, and then change to the other side and make sure she could distinguish these smells. Cranial nerve 2 is assessed by having her go through the 6 cardinal gazes, so with her eye movements. So I'm going to hold your chin, and then I want you to follow my finger. So and she was able to do all those, so that cranial nerve is also intact. And that actually would be, I think I misspoke, that would be cranial nerves 3, 4, and 6 that help to control those muscles for doing those eye movements. The cranial nerve 2 is actually assessed by doing the eye chart, either a near eye chart or the distant one, the Snellen eye chart. That would assess the cranial nerve 2. Cranial nerves 9 and 10 are checked by taste as well as gag reflex. So I do not want to make my patient gag, but what I would do is use a tongue blade, and I could hold down her throat and hold down her tongue and either use like a cotton tip applicator to just barely touch the back of her tonsils to see, or the back of her tongue to see if she has that gag reflex. The other thing you could assess is the ability to swallow to assess those nerves. And cranial nerve 11 is checking the strength of the trapezius muscle. So I'm gonna hold onto your shoulders and shrug up. Good, and then she's got good strength. She's able to resist me pushing down. And then finally, cranial nerve 12 is checking the strength of her tongue. So now what I'll have her do is I'll put my hand on the side of your cheek, and you just need to stick your tongue against your cheek and push. Good. Same thing on the other side. Good. So that is all of her cranial nerves, and everything is intact. I'll stop for a second. Alright, so next moving on to the eyes. So visually first you just would inspect, look to see, make sure everything's symmetrical, note any differences of the external eye. And then also you want to look at the lacrimal gland and make sure that it looks like her eyes are moist or not dry, anything like that. And ask if there's any pain with any of this. With pressing on that part of their face. No pain? Okay. Then, once you look at that, look at the eyelashes, everything just around there, that it all looks like it's normal. Then you start to inspect the internal eye. I do not have the ophthalmoscope, but I do have a pen light, so I will check for the pupil response. So this will be bright. Making sure that her pupil constricts as it's supposed to. And then the other thing, you just kind of shine the light to the side to make sure that there's no opacities, anything like that, that the light is reflected equally, evenly on both sides throughout the entire eye. The next thing would be to check, I did already check her ability to move when I was assessing her cranial nerves, so the movements of her eyes are normal. The last thing would be to do is the cover-uncover test. So, let me I'm going to have you look straight ahead, maybe just look straight ahead at the camera. And I'm going to cover one eye and look at the other eye to see if there is any drifting or movement of the eye while she's looking straight forward. Same thing for the other eye. And there is no movement or change to the eye that is uncovered. Okay? And what else? If I did have the ophthalmoscope available, what I would do is look straight into her eye and be able to see the red light reflects in the back of her eye. That would be what would be normal. And I think that is it for the
Little orange thing.
Yeah, I think we're good. Okay, next I'm assessing her ears. So first again, inspecting, making sure they're symmetrical, looking at the outsides, looking behind to see if there's any issues with skin or pain, asking about any pain or sensation issues. Then as far as looking at the external ear, those would be the things you would look for. Internally, I would use an otoscope to be able to assess the inner ear, making sure that there's not too much wax that could be affecting hearing. Also looking at the tympanic membrane. It should appear like a light gray, kind of shiny color. It should be completely intact. There should be no redness, swelling, drainage noted anywhere in the internal part of her ear. As far as assessing her ability to hear, we can do that with what's called the whisper test. And so you stand about a foot or so away from the patient and ask them to go ahead. Can you occlude your ear on the opposite side for me? And I'm going to whisper 3 either letters or numbers, and I need you to repeat them to me. So
3T9.
okay, and then on the other side.
4MZ.
And the patient should be able to at least get those right 50% of the time, if not more. The other test is called the Rhine test, which is used with a tuning fork to identify any sort of, whether you would have any sort of hearing loss, whether it be bone conduction or if it's auditory hearing loss. So with the tuning fork, what you would do is strike the tuning fork, and then you would hold it up against the mastoid bone right behind the ear, and time how long they can feel that they can hear that vibration. That would test the bone conduction. Then to test the air, the auditory conduction, you would, same thing with the tuning fork, but just hold it right next to their ear, not touching anything, and see what the difference is there in the amount of time that they can hear. Normal would be that you would hear the air conduction twice as long as you would hear the bone conduction. And I believe that is it with the ears. The nose, go ahead and move on to the nose. Same thing as far as looking first to inspect the outer nasal structure. And again, to palpate and see if there's any tenderness or anything there. You can see if there's been any trauma just from looking to see if there's anything that was broken at any point that may affect their ability to breathe. Otherwise, again, you could use a pen light, you could use the otoscope or ophthalmoscope, the light source from that, to be able to look at the inside. Just looking to see if the internal nose structure is pink, it's moist, that there's no issues, no bleeding, no pain, anything there. And as far as assessing their ability to smell, that is done, again, when I spoke of the cranial nerve 1. And the other thing too, just to make sure we could check the patency of each side, by occluding one nair. She holds one side closed and takes a good deep breath through her nose. And then to do the other side. And just noting the sound and her ability to breathe and to be able to do that. And that's it. So now I'm going to look at her mouth and internal structures inside her mouth and pharynx. Okay, so again, looking at the outside, just inspecting, and because I'm going to be inside of her mouth on a real patient, I would have gloves on, of course. But looking at the lips, looking at the skin around for any abnormalities, sores, things like that. Looking for the moisture on the lips, things like that. Gloves, I would also have a tongue blade to be able to look at the back of her throat. So if you could open for me, I'm going to be looking to make sure that everything's pink and moist, that there's no sores or lesions or bleeding, inspecting the teeth, looking at the teeth, looking at the gums, looking at the back of her throat at the tonsils, seeing if there's any swelling, redness, any pus or anything like that. Also, looking at the teeth, you can tell how well they take care of their mouth. You can see, what am I trying to say? Yes. So I'd also inspect her gag reflex at this time. I did already talk about that though with the cranial nerves. And I think that is it for the mouth. Next we would move on to looking at her neck, looking at the skin, inspecting the skin, looking at the structures, the musculature, making sure that there's everything's symmetrical, looking at the parts on her neck here where if she had any jugular vein distension, I would be able to see any protrusion there. I would, to again inspect the muscles, just be able to turn. And this would be passive motion, and then front and back. And then I would ask her to do it on her own to be able to go back and forth, and that would be active motion, assessing that. She doesn't seem to have any trouble with that. We also checked her shoulder shrug earlier, and she did that without any problems. Next, we would, after inspecting all the musculature, then I would inspect each of the lymph nodes for any swelling or lumps. So the occipital, the post-auricular, pre-auricular, down to the mandibular, submental, and then down along her neck, the clavicular, feeling all those areas to see if there's any swollen lymph nodes, any tenderness, any pain. I would want her to be able to tell me that. Next, I would look at her neck midline here, see if I could see any deviation of her trachea, also assessing the thyroid to see if there's any swelling or enlargement there, and there is not. And then checking for her carotid pulse, making sure I can feel on both sides, it feels the same. And lastly, I would listen for any sort of bruit with the bell of the stethoscope. So I would listen to her carotid on each side to see if there is any abnormalities in the sounds. And that's it. Alright. Next I'm going to inspect, assess her upper extremities. So again, if the regular patient would just have their arms exposed because they would have a gown on, but what I would do is I would look at her arms, I would look at the skin, take note of any skin issues, and also the movement. So she has no problem with any movement, range of motion. I would ask, of course, if there's any pain with any of that. On both, I would check her radial pulse. Feel that they're both symmetrical, that the pulses feel the same on both sides, and also see if I can feel her brachial pulse, same thing, see if I can feel on both sides. She's got good strong pulses, and that is it. Looking at her nails and her fingers too for the characteristics there. I'd be noting any clubbing or any issues, breakages, things like that with her hands, fingers, nails.
Okay.
Next, again, this would be kind of part of the inspection just before I would assess her lungs, but it would be looking at her back, just observing, inspecting the skin for any issues, and just looking at the shape of her back, the shape of her thoracic spine. Everything should be in line. Both sides should be symmetrical. Watching how she breathes, that both have her take a couple deep breaths and see that both sides move up with each breath. Everything is equal, symmetric, and there's no dimpling or anything in the musculature when she breathes. Then, as far as assessing her lungs, again, I would inspect and listen to her respirations. Just while we've been talking, I would be able to hear any obvious sounds or any wheezing. I could potentially be able to hear just from our interaction. Also noting if she's using any accessory muscles to breathe, the rate, rhythm, and if anything's labored at all with her breaths. Then I would palpate again, and I can put my hands here and have her take a deep breath, and the hands should move symmetrically when she takes those deep breaths. Then I would have her say the word dog.
Dog.
And just keep repeating it.
Dog. Dog. Dog.
Say baby.
Baby. Baby.
And I'm just feeling
Baby.
to see if there's any
Baby.
tactile parameters. You can stop. Oh, yeah. So I'd be feeling for that, feeling for any vibration. Then I would do percussion, and I will be easy on her. She recently had a broken rib, but for the percussion, I would want to feel over any of her lung fields that the percussion was resonant, that it sounded, didn't sound dull, didn't sound like there was anything solid there, because this should all be filled with air. So places where you would percuss that may be solid, if you got directly over the bone or over her kidneys or over, if we were over here laterally over her spleen, but this is the side where she has the broken rib, so I will not do that. Next, I would go ahead and listen to her lung sounds. And so I'll have her take a couple deep breaths for me. Okay, and you don't have to keep deep breathing because, one, it probably hurts with her rib, and two, your patient will get tired after you're listening to all these different spots. But what you will do is listen back and forth to see if both sides sound similar, and then So those would be the posterior lung sounds. You would also listen laterally to hear the different lobes of her lungs, and again, listening for the sounds. You would want to hear clear, open airways, and you would not want to hear any crackles, wheezes, rhonchi, anything like that. And the same would happen on the front of the chest. You would also listen to lung sounds going from one side to the other, listening to see if they sound the same on both sides or if there's any differences. When I reviewed my assessment video, I realized I did not discuss diaphragmatic excursion, so I was going to go ahead and do that now. I don't have my patient, but I was going to use this holiday snowman to explain. So I'd have the patient, the back of their upper back would be exposed because they would have a gown on so that I can see the skin. And what I would do is have them take a deep breath in and hold it, is how I would instruct them. I would go down mid-back and percuss down the scapular line until I heard it would all be resonant, and then there would be a dullness, and that would be the first mark. And I would go ahead and tell the patient to breathe. I would take a piece of tape that I have here, and I would mark where I've percussed that dull area. Have the patient take a couple deep breaths in and out, and then I would ask them to take a deep breath in and exhale completely and hold that. I would start from the taped line and percuss up until I heard the resonance, and then go ahead and tape there. Go ahead and tell the patient they can breathe normally. At that point, I would measure the distance between here. Normally it should be anywhere from 3 to 5, even 6 centimeters. If it was anything less than that, there would be some concern with the ability of their diaphragm to move. You can see that in patients with emphysema, any sort of abdominal tumor, any liver engorgement, anything like that could affect the ability of the diaphragm to move. So that would be an abnormal. We would also do this on the other side to see the two sides should be somewhat symmetrical. The right side, again with the liver there, may not be able to move quite as much, or it may be a little bit higher where that distance is measured. And so now I'm going to go ahead and assess the anterior aspect of her chest and her, and also listen to her heart. So again, just inspection, looking at the patient, making sure the front of her chest, everything looks symmetrical, looking at the skin condition, looking at the way that she breathes, noting any labored breathing or any use of accessory muscles, also being able to look directly at the chest wall to see if there's any issues, any injuries, things that would affect her heart, her lungs, her breathing. And I would palpate the wall too, and also feel any breathing, feel if I can feel her heartbeat or any, like if her heart was beating too hard, anything like that, if there was any sort of stress there. And then again, I would have you say the word dog.
Dog.
And I would feel for the frontitis, and note that it should essentially feel, that vibration should still feel the same between the front and the back side of her. Let's see. I can also check for, under her arms, for lymph nodes, noting any swelling or anything there too with the front side of her chest. Then percussion would be the same as far as, it should sound fairly resonant. Any places that I'm percussing here over the heart, it would sound dull. Then I would listen. I'll go ahead and listen first. I would listen to her breath sounds, which I kind of already mentioned when we were talking about lungs a second ago, but I would listen one side to the other to make sure that they sounded the same along on the way down. And then I would listen to her heart sounds. So I could listen to her each different valve, so the aortic valve, and then I would listen to the pulmonic valve, then down to Erb's point, the tricuspid valve, and then the mitral valve, which is right at the apex, typically the loudest heart sounds. I would be assessing for regular heart sounds with it would be S1, S2, so I'd be listening to see if there would be any S3, 4 noted, or any murmurs, clicks, rubs, any of those things would be abnormal findings. I think that is it for the anterior chest. I'm not very good to my patients. So now I'm going to do her abdominal assessment. First thing, again, you inspect the skin, and inspect for any pulsations in the abdomen. Everything should be a good contour, should be symmetrical. Inspect first, and then second you want to listen before you would do any palpation or percussion to assess for bowel sounds. And so I would listen over each quadrant. And hope to hear basically what sounds like bubbles in every quadrant. So then I know that her GI system is active and it has motility from those sounds. Then once I've listened to bowel sounds, the next thing I would do would be to auscultate over the arteries that I could listen to in her abdomen. Those would be the aortic, the iliac, the femoral, and the renal. And you would use the bell of your stethoscope. You're listening for any bruits, any swishing, any abnormal sounds from those arteries. If there was any sort of blockage or occlusion, you would hear a turbulent sound, and that would be of concern.
Hi.
This is what Luke gets to edit.
Hi.
He's just doing an assessment.
He's just checking my pulse.
You're doing a good job.
Go on, bud.
Oh, I love it. Okay. Whoops, sorry. So, oh shit. Next I would percuss her abdomen. And everything should be very resonant, and because again, all inside here would be expected to be is gas going through her intestines. You could percuss though if you found anything. If you were percussing and found like a dull spot, it might be it would be over the liver or over the spleen, and firm sound, and you would want to make sure that neither of those were enlarged. But that way you can also see. And as far as actual palpation, you would lightly palpate the abdomen, ask for any pain.
It's in the back.
But you would palpate, you would want to do some deep palpation over the liver to be able to palpate the border, again, to make sure that it's not enlarged. Same with the spleen over on this side, but this is where her rib was injured, so I will not palpate there. And also over the kidneys, making sure there's no pain on palpation with those. But you should not feel any, also with palpation, you shouldn't feel any, over the aorta, you should not feel any pulsations, pulsations over that. While you're also palpating, you can feel the abdominal muscles, making sure that they're all intact, that there's no injury there, and I think I got all that. And again, while you're assessing the patient's abdomen, you want to ask again if there's any pain on palpation. Ask in general questions too about bowel bladder habits, things like that. And I believe that is the end of the abdominal assessment, which is kind of funny. She was kind of a mess.
Okay.
So now I'm going to assess her feet and legs and then kind of move into assessing her musculoskeletal system. So what I would do is I would go and I would inspect. I would look at her legs and look at the skin, note any issues. Again, she would be in a gown and it would be a little bit easier to assess the entire leg, but look for any issues with the skin. Same thing with the feet, look at the feet, look for any abnormalities in the skin or sores or anything like that, especially in diabetic patients. Noting any sores or lesions on their feet is important to make sure that those get healed properly. Checking for pulses, and checking the temperature of the skin. Is it warm? She's got good circulation. I can feel her pulses in her feet. Also noting, since she's been standing the entire time, that she's got good muscle tone, good balance, good strength, which, and also with looking at her feet, I would note any sort of swelling, edema, anything like that as well. Moving on to the musculoskeletal system, I would, since I have her standing, check her ability to bend over and touch her toes. And at that point, I could check to her spine, making sure everything is in line, and it looks like she is pretty flexible. The other thing that we could do to check muscle strength would be, I could hold her hands, but I would have her do a squat. Good. Just trying to keep the patient, make sure that they're balanced. Also, I could check the strength in her arms, so hold her hands out. I'm going to push down on your arm, so push up against me, resist. Okay. Same thing. Good. And now resist in. Good. I think we did this already, but raise your hands all the way over your head so I know that she's got good motion and flexibility in her shoulders. What else? Go ahead and sit down for me. So next I could check the strength of her, strength of her quads. So I'd have her Again, resist my force. Same thing, this will check her hamstring. Good. Now the other side, resist and resist. Good. I could check her feet and ankle strength too. So pushing down, she's resisting me. Same thing. Okay. Next, I would use a use a reflex hammer. If I didn't have one, I would check her reflexes by just striking right underneath her kneecap on both sides, making sure that she has. Did I get that one?
Yes.
She has those reflexes. Then the next one would be on her her bicep reflex. And you would strike right behind the elbow to get that reflex. Those should all be intact and should work easily. So, and that is it for the musculoskeletal